Welcome to the COVID-19 Physician Learning Series, brought to you by Jewel and the Canadian Medical Association. I'm Dr. Gillian Horton, a general internist, writer, and podcaster, and I'm your host. Over the past few weeks, COVID-19 has upended healthcare systems around the world. Today, we're going to explore how compassionate leadership can help organizations overcome some of the hurdles they're facing and tap into the strengths of their staff. Joining me is Michael West, a professor of organizational psychology at Lancaster University Management School and a senior visiting fellow at the King's Fund in London. He's spent 30 years focusing on organizational culture and leadership and worked directly with a number of health agencies to develop compassionate leadership models. Michael, thank you so much for joining me today.
It's a pleasure to be with you, Jill. Thank you.
Before we talk about your actual work, can we just talk for a moment about how you became interested in this particular field?
I was always very interested in how teams and organizations can function most effectively. I did my PhD when I was in my 20s on the psychology of meditation. And in the middle of that work, I ran out of money. And I was living in Wales at the time, and I went and worked in a coal mine for a year as a laborer. And I was astonished by how important the team that you worked with was in terms of your safety and your well-being. So I became very interested in teams and organizations and how they functioned and how their structures and processes affected performance and safety and the well-being of people at work. And so my research took me into healthcare organizations back in the 1980s, and I have been fascinated by the functioning of healthcare teams and organizations and deeply impressed and inspired by the work of healthcare professionals ever since.
The stresses on the healthcare system are immense right now. Now, you're in the United Kingdom. What are you hearing from healthcare leaders there about the challenges that they're facing?
So, of course, these are completely unprecedented times and the challenges are enormous. I think that there are four that I keep hearing from healthcare leaders. The first is staff shortages. When we started in the middle of this pandemic, we were already in England 100,000 staff short in our healthcare system. That's 8% of staff were missing. And now we have staff shortages because of COVID, staff who are unwell, staff who are having to self-isolate. So that's added to the burden on our staff, already under huge pressure and under more stress than they have been in the history of our health service since 1948. Secondly, there's been an enormous problem of access to personal protective equipment. The demand for PPE has gone up 5,000% in the last 5 weeks. So staff are being asked to work in conditions that are frankly terrifying at times and very upsetting and discomforting for everybody involved in health services. Third is the problem of testing for staff. Our testing regime in England has not been prepared for a pandemic like this. So many staff are not able to get tests or are having to travel very long distance to get tests to see whether they're positive for COVID-19. And fourth is just the huge demands on staff, of course. Dealing with unprecedented situations. I was talking with an ICU nurse last week who had experienced 9 or 10 deaths a night in ICU, where they would normally expect at most 1 or 2 a week. So the emotional demands are huge. And also just the level of fear among staff, the fear of their own death or the fear of infecting their families. And that all of those factors, I think, accumulate to place enormous pressures on our health and care staff.
So let's talk for a minute about how a compassionate leadership model can help to address some of these challenges.
So compassionate leadership, I mean, it's a concept. It sounds very attractive and supportive. In practice, what it means is four things. It means leaders who are present with their staff, who attend to them, who, as Nancy Klein says, listen with fascination. Second, leaders who seek to understand the challenges that their staff face, not by imposing their own understanding, but through a dialogue. And third is leaders who have an empathic, a feeling response for the difficulties that staff are experiencing, those difficulties we talked about a moment ago. And fourth is the importance then of helping those we lead by removing obstacles to them doing their jobs effectively or acquiring the resources. So in these conditions where staff are under enormous pressure, it's vitally important that those compassionate behaviors are manifested by leaders. And I always reflect, that our healthcare staff are probably the most motivated and skilled workforce in industry. And we should be listening to them and learning from them, utilizing their knowledge, their skills, their abilities, their motivations to be compassionate and caring, so that we manage in these unprecedented situations, and we manage those particular challenges that we talked about more effectively.
You've used the ABC acronym to describe the elements of compassionate leadership. So they're autonomy and control, belonging, and competence. Can you take us through each of those three elements?
So if we're to lead effectively, at the best of times, let alone in a situation like this, then our leaders must understand what are the needs of those they lead in the workplace. And we have an abundance of research that tells us there are three core needs that people have to maintain their well-being at work and to maintain their motivation. And they are the ABC of people's core needs. The first is the need for autonomy and control. That doesn't mean that people need to be independent and do whatever they want in the workplace. It means that they need to feel they have voice and influence, that they can influence how the work that they need to do is done, that they're not simply being coerced and directed, and that they have some degree of control. And that extends to control not just over how their work is done, but very simple things like having access to hot food on night shifts, to having places to rest, to being able to go and get a drink when they need to. Those very basic control factors within our work environments. And belonging, the importance of belonging is about feeling that we're part of a team where those we work with care for us, we care for them, feeling that we work in an organization which is, we're part of a larger caring whole, and where the culture is one of compassion. After all, the core value of healthcare staff is compassion. So they want to feel that they work in organizations where that value is shared by those who lead them. And the third is the importance of a sense of competence in the workplace. I need to be able to feel I can do my job well in the context of healthcare, that I can provide the quality of care that I need to provide. And that means ensuring that obstacles that get in the way of me doing my work are removed, that I'm not dealing with a chronic excessive workload which undermines my ability to provide the quality of care that I want to provide, and also diminishes my own ability to work in a way that ensures I don't make major errors, and to ensure also that I'm getting the training that I need to do my job effectively. So in the context of the pandemic of COVID-19, it's making sure that in these really unprecedented situations, staff feel they have voice and control. They have a huge workload. And we know that a deeply toxic combination is a high workload and a very low sense of control. So it's vital that we're hearing the voices of our skilled, motivated staff in helping to solve the problems that face us. Staff are afraid, and we manage fear to a great extent by being connected with others who care for us, by a sense of belonging. So building effective teams where people feel supported, where they feel listened to, where they feel that they can voice their problems, their concerns, their difficult feelings, makes a huge difference to that. And in terms of competence, I talked about the four factors or the four behaviors of compassionate leadership: listening, or attending, understanding, empathizing, and helping. We know the most important skill of a leader is listening, and the most important task of a leader is helping people to do their jobs effectively. In other words, helping them to feel competent so they don't have a profound sense of moral distress in not being able to provide the care they wish to provide. You know, the example I gave earlier of the ICU nurse facing so many deaths, it's absolutely vital that we are focused on the core needs of the people who are working in healthcare, and we're providing that compassionate leadership as a supportive context in these enormously challenging times.
Michael, are there some other practical ways that leaders can put the principles of compassionate leadership into action right now?
So, I think one of the really important insights leaders should have is that we know that in crises, research from other sectors and at other times has told us that in crises, leaders tend to revert to a kind of threat rigidity mode of leadership, which is very much focused on directing people, command and control. And it's therefore important that leaders make sure that they are not slipping into that they're taking the time to listen to those they lead, to understand the challenges they're facing, to feel for them, difficult as that is, and then to help them. It's also, I think, really important that leaders exercise self-compassion, because in order for them to have the resilience and the ability to be compassionate, it's really important that they take care of themselves too. And that's about paying attention to ourselves, understanding the challenges we face in our work at this time, empathizing with ourselves, caring for ourselves, and then taking intelligent action to help ourselves in order that we can be the best leaders we can be and provide the support that healthcare staff need at this time.
Michael, healthcare is often understood as having a very specific culture. And as we both know, historically, it has sometimes been a culture that has pitted itself against compassionate care and leadership. So for organizations that don't make that pivot to compassionate leadership now, what do you think lies ahead of them both during and after the pandemic?
It would be a tragedy if at this time organizations didn't value that core commitment to compassion. Compassion's the most powerful intervention that we know of in healthcare. And compassion is the core value of virtually all our healthcare staff. And the role of leaders in organizations is to embody the values of organizations and ensure a fit between those values and the values of staff. So when staff feel their organizations are not sharing their values, of course, it creates a sense of dissonance, of lack of commitment, of lack of connection. At this time, there is so much fear and uncertainty amongst our population at large and amongst our staff. And those four behaviors, which we know from decades of leadership research, are the most important leadership behaviors, regardless of whether you label them compassionate leadership or not. They are the most important behaviors in ensuring effective leadership. If we want to respond effectively to this crisis, if we want our staff to be at their most effective, if we want them to have the highest levels of well-being possible during this time, then those four behaviors of compassionate leadership are absolutely fundamental. And it's not just our healthcare organizations, but our countries as a whole. There is a loud background hum of anxiety, of fear amongst our populations. The most important institution in our countries right now is our healthcare system. And we see that globally. We see the outpouring of relief from the population, of gratitude, of honoring those staff. And it's vital, therefore, we create compassionate cultures that enable staff to deliver compassionate care, because healthcare staff constitute probably something like 1 in 20 of the working population in most countries. If they're experiencing compassion in their cultures and in their leaders, they will practice compassion in their treatment of patients. They will take that compassion back out into their communities and reinforce, I think, the collective commitment to compassion and the gratitude of the population. We have to honor what our healthcare staff have sacrificed, what they've committed to, what they have been doing during this period, not just now, but in the way that we manage and organize our healthcare services in the future. The level of innovation that we've seen in healthcare as a result of the actions of staff at the front line has been astounding in our country. The level of commitment, the level of courage, and the sacrifice. And we have to honor that, not just during this time, but after we get through this pandemic and we create new institutions that are appropriate homes for these people who have made such sacrifices and saved so many lives and inspired us all.
Well, I'd like to end this session by thanking you, Michael, for your time and your insights into compassionate leadership. You've offered a very important window into a particular way that healthcare can harness this moment for change as well.
A pleasure and a privilege for me, Jill. Thank you.
I'm Dr. Gillian Horton. Thank you for joining me for this COVID-19 webinar brought to you by the CMA and powered by Jewel. Take care of yourselves, and I'll see you again soon.